So in this mechanism, is it a crush injury? Is it the compression because of the prolonged positioning, like in your common peroneal nerve it occurs? So what is it? So depending on that, there will be tissue reaction and scarring. If it is a badly lacerated injury, then their scarring is going to be much more. So there are chances that nerve may get trapped into those scars, and there are chances of neuroma. So depending on that, also the scar will reduce the mobility not only of the structure, skin, the joint, as well as the nerve mobility also could be compromised. So clean versus crush injury. So crush injury will lead to a lot of scar formation. The tissue reaction is going to be worse. So there is going to be a lot of pain. There is going to be a lot of edema. In clean injury, the chances of scar formation and all are going to be less. The other structures involved. So if the other structure involved is going to be bone, there are fractures, there are ligament injuries, there are arteries, which whatever structures are going to be injured, depending on that, again your treatment protocol will change. If it is a a bone fracture, then you need to think about the healing time for the bone. The treatment should focus also on the joint stiffness, maybe proximal to that bone, or the where the joint is the joint which is proximal to the bone, and the distal joint as well. So if it is the ligament injury, depending on the what is going to be immobilization period, you have to change your treatment. So treatment for all this also should be included. It should not happen that you are focusing on the nerve recovery at the same time the joint has become stiff. So this is what information is required earlier when we start with our treatment. Next is when we consider the surgical management. In surgical management, date of repair, very important. Otherwise we do not pay so much of attention to the date. But here it is very important because it's a nerve and it's going to be, when it has been repaired surgically, it is going to be a delicate structure. So, and whenever a nerve is repaired, 3 to 5 weeks of maximum protection is required. So date of repair is very important. From that 3 to 5 weeks, we need to have the protection for the nerve. So how are we going to protect the nerve? The position of the joints should be such that the nerve is relaxed. Because tension on the nerve or stretch on the nerve can lead to impaired results, or it is going to lead to non-healing of the structures involved. So sorry, I got disconnected, I think. Am I
Yes,
audible?
ma'am.
So it is the position of the joints which is important. If it is